Hi, this is Paul from Jones Physical Therapy. TMJ pain can be a very frustrating problem with disturbed sleep, pain while eating, constant pain during the day. And many of the treatments that are recommended for TMJ focus on the joint itself: injections, medication, night splints. But there are many other things out there that may not be typically recommended by healthcare providers that can help also. So these things may work either on their own or in combination with other more conventional treatments. So this week's blog is 6 things you can do to help your TMJ pain. All right, so first is fix your neck. TMJ exists in its own right as a diagnosis. However, when you're talking about musculoskeletal problems, often problems in one part of the body create problems in another part of the body. If you've got stiffness and tightness in one area, it can transfer stress to another area. Also, muscle pain and tightness can spread from one area to another through a phenomenon called radiation. Checking out your neck, first thing to do is go see a physical therapist. Often, if your TMJ is your number one problem, you're feeling all that pain in the TMJ and you're not focusing on the problem in the neck. Also, neck problems with tightness, stiffness, and postural issues may creep up over time, and you may not realize that you're having a neck problem or that is something that is contributing to your TMJ. If you're not sure what to do, just go see a therapist, sit down with them, get an educated opinion. So that's number one. Next on the list is dry needling. Dry needling has become very popular over the past few years because it's great for reducing muscle pain, reducing muscle tension, and improving joint movement. So the TMJ is no exception to this. Often pain in the neck and head can be relieved in just a few minutes with some expertly placed needles. Dry needling also does not involve medication, so there's no side effects. It also lasts about 7 days, so TMJ sufferers after a dry needling session can feel less pain, sleep better, and feel good for up to a week, and then come back for another treatment. So next on the list is massage. In the same way that physical therapy and dry needling relieve muscle tension and normalize movement, so does massage. Massage normalizes tone in muscles. So TMJ sufferers often get a massage once a week to normalize the tone in their neck. Not only does it give them relief at the time, but also when you kind of reset the muscles once a week, it re-educates the body and tells it what normal muscle tone should be like. Next on the list is headaches. Headaches and TMJ come together, and often they're treated separately. So if you treat the TMJ and not the headache, or the headache and not the TMJ, often you don't get the results you're really looking for. So if you're treating your TMJ and you're not addressing your headaches, then think about going to see a healthcare provider and get those headaches under control also. Next on the list is relaxation. As with massage, time spent dedicated to relaxation pays big dividends when it comes to TMJ. In TMJ, stress and anxiety are often part of the bigger picture, and just being in pain makes you more stressful and anxious. So scheduling an hour of yoga or meditation into your week can help you get that pain under control, sleep better, and manage your condition. Next on the list is food sensitivity. Dietary advice for TMJ usually involves food size and texture. And yes, you shouldn't eat raw apples or chew hard food or chew gum when your TMJ is flared up. But what about sensitivity to food? Food sensitivity and allergies are well recognized as triggers for things like migraines and joint pain. If you Google anti-inflammatory diet, you'll come up with a whole list of different things. The only way to really know if you're sensitive to something is to have a food allergy test. So consider having one of these tests and see if there are things that you can eliminate from your diet that'll improve your TMJ symptoms. I hope you found these tips useful. What I would say to you, if you're suffering from TMJ and you're not getting the answers you want, keep looking, because there's a lot of solutions out there. TMJ and other painful conditions, people can suffer from them for months or years, and then they make a breakthrough because they try something different. So try some of these 6 tips I've given you. Also, there's plenty of information on the internet about how to manage your condition, and you can find out what works for you as an individual and start feeling better and start living the life that you deserve.